The U.S. recorded more than 4,300 coronavirus deaths on Tuesday. That is, again, a new high. And while states are rushing to get as many people vaccinated as possible, officials in Ohio are sounding the alarm on a new threat. Carter Evans reports.
Tonight, a new warning from the White House Coronavirus Task Force. There may be another, more contagious strain of COVID found here in the U.S. This, as the dangerous strain from the U.K. is now detected in 11 states. Arizona leads the nation in per capita COVID cases and hospitalizations. This massive stadium, home to the Arizona Cardinals, now a mass vaccination site for healthcare workers, first responders, teachers, and child care workers.
That's a pretty big swath of the population there.
It is. It is. So we knew that when we moved from phase 1A to phase 1B, it was going to significantly increase the people who were eligible to be vaccinated. So we knew we needed additional opportunities.
A little bit of a hope.
The race to vaccinate is taking on added urgency. California now with more than 30,000 COVID deaths.
In my 34 years, I've never thought I would see anything like this.
Ken McKenzie runs a Southern California funeral home. This time last year,
there would probably be 2 or 3 people that I'd be caring for. Right now, there's probably 40 to 50 embalmed bodies here with families waiting to have closure.
the people in the cars behind me are all in line for a vaccination here at Cardinals Stadium. Now, health officials are prepared to give out at least 6,000 shots a day, and this site will be open around the clock for at least the next 2 months. Lana?
At least good to see those people getting their vaccinations. All right, Carter, thank you. Dr. Richard Besser joins me now. He is the president and CEO of the Robert Wood Johnson Foundation and the former acting director of the CDC. Dr. Besser, always good to see you, even when the news is not good. More than 4,000 Americans lost their lives due to COVID on Tuesday alone. I'm wondering, when are we going to turn the corner on this pandemic? Do you expect that things will continue to get worse before things get better, or might these numbers actually start to go down soon?
You know, Lana, when the pandemic first hit last year, we talked about how bad it could get this winter. And there are many reasons for that. Viruses like the winter, they survive longer, they stay in the air longer. But we're also facing incredible pandemic fatigue. And the news is so focused on vaccination, and vaccination is critically important. It's going to lead to the end of this pandemic, but it's not what's going to make the big difference this winter. This winter, what will truly make the difference is if we can come together as a nation and ensure that we're practicing those things that will reduce transmission. So wearing masks, keeping apart, washing our hands. Hopefully when Congress comes back at the end of the month, they're going to put in place those measures that need to be there so that people can protect themselves. You know, this last round of money that came to people was really 1 month of support. We need to make sure that there are dollars coming in to support people, that eviction protection is extended, that rent support expands way beyond what was done so far, and that they continue to expand unemployment coverage and benefits. Those are the things that will allow people, if they're exposed, to stay home and stay away from other people. It will allow people who are infected to stay home and still be able to put food on the table and pay the rent. But if we don't do those things, you know, it will be a long time before this turns around, and we will truly need to wait for vaccination. If we do these measures, vaccination and these measures together, we will see a much more rapid decline in this pandemic.
Well, I want to ask you a little bit more about these measures, because there's also some additional news with this coronavirus variant that first emerged in the UK. It's now in the United States. In words that a layperson like I can understand, what makes this strain actually more contagious? And how does that mean that we need to change our public health behaviors? Does that mean we need better masks, more rigorous cleaning protocols, tougher public health measures, less time indoors with other people? In what ways does this variation actually complicate things for all of us?
Yeah, I mean, there's still work being done to try and understand why does this strain of COVID transmit so much easier. Thankfully, it doesn't cause more severe infection. It doesn't lead to a higher rate of death. But the fact that it spreads easier is a problem. It means that more people will get infected, more people will be hospitalized, and more people will die. It may be that when you get this strain, more viruses multiply in your nose, and so it's easier to spread to other people. But it's still not a fully answered question. In terms of what it means in terms of our behavior, is what it says is that any lapses that we have, any lapses in terms of protection will lead to more transmission. And we know as a nation, we are incredibly divided, where half the nation feels we're not doing enough and half the nation feels that we're doing too much. And that is just a setup for a strain like this to spread rapidly and spread widely around our country. And while the pandemic is hitting every community, those that will feel the brunt of this are those frontline workers, people who are exposed to other people day in, day out because of their job, people who have to work to put food on the table and to pay the rent. And I really worry that people of color will bear the brunt of our unwillingness to come together as a nation and really all follow these measures.
Yeah, I think that's a good point, Dr. Besser, that frontline workers are not necessarily just hospital workers, but all the people who continue to be out there meeting all of our basic needs and allowing us to continue to live our lives in this pandemic. All right, so the Trump administration says that states can begin vaccinating adults with comorbidities and people 65 years or older. Happy to report that my parents actually just received their first dose of the vaccine. But Rich, what is taking so long to roll out the vaccine? I understand that it's not a panacea, that we still have to be doing all these other things, but the vaccine is vitally important. I'm wondering if you can tell us more about these new guidelines and how each of the states trying to make up their own protocols are further complicating those efforts to get shots in arms.
Yeah, I think, Lana, there are a number of reasons why it's going slower than anyone would want. Part of it is that there was such an incredible delay in the federal government giving the dollars to states so that they could hire people, so that they could set up the systems that are needed to distribute these vaccines. I'm a general pediatrician. I'm used to vaccinating kids all the time. But there, it's a tried and true system where the vaccines come to every office. They're going to be there. The supply chain is all set up. Here we have two vaccines that have different storage requirements, different requirements in terms of spacing of doses. And while I'm excited to see the numbers going up in terms of the number of people daily who are vaccinated, if that's going up by increasing vaccination of people who are well connected, people who are over 65, who have the resources, the connections to be able to get vaccinated, and we're not seeing an increase in vaccination of essential workers, of frontline workers, not just healthcare workers, but as you were saying, the people who keep society going. If those numbers aren't going up, we will continue to see a disparate impact of this pandemic, and we won't see the kind of reduction in severity that we really all want to see.
All right, one last question for you. I want to ask how much you think that our norms have changed as a society. I'm remembering you saying years ago that there is nothing noble about coming into work when you're sick, and it seems wild now to think that people actually used to do that all the time. Do you think we might keep some of our public health norms even after the pandemic is under control, or do you think that we'll see a rebound of other viruses, including influenza, norovirus, once we start to reemerge from the pandemic?
Well, I hope we learn from this. Some of the things that we may want to continue in terms of trying to reduce the impact of some of these infections that occur every year. This is really the mildest, lowest flu season in memory, and not just flu. There are a number of other viruses that tend to spread in the winter, and their rates are really, really low. It's because we're social distancing, we're wearing masks, and we're washing hands. And while we're not going to want to implement those kind of severe measures every winter, it will encourage people, I hope, to wash their hands more, to keep away from others when they're sick, to get their flu shots. These kinds of things can really make a difference. And maybe it will mean that in the winter, we are wearing masks when we're in the indoor settings where viruses could spread. We may learn something about mask wearing that has application once this pandemic is over as well. And that would be a good thing if we can reduce the burden of some of these diseases that every year cause big problems.
All right, Dr. Richard Besser, thank you.
Thanks so much, Lana.